Hey friends, if you're having trouble with knee pain, I have a great video for you today. I'm going to walk you through the top 3 hip exercises that will help improve your knee pain. Here we go. Welcome back friends, Dr. Josa here to help you move better and feel better. Thanks for tuning into the show today. And if you're new to the channel or haven't already, make sure you hit that subscribe button so you don't miss it on future videos. The hip muscles can play a big role if you're experiencing knee pain. We focus so much of our efforts around the knee that sometimes we forget up the chain, up the leg at the hip. The glute muscles can play a big role in stabilizing and controlling of the knee. If these glute muscles are weak on the outside and back of the hip, we can have a lack of control of the upper leg and at the knee. This sometimes leads to excess movement of the upper leg, causing increased stress of the kneecap and the knee joint itself. This can be visualized with collapsing of the knee inward, or valgus, where the knee comes in towards the midline of the body, causing more stress on the knee with walking, with stairs, running, and jumping. By strengthening the hip, the glute muscles, we can improve control of the upper leg, improve control of your knee, decrease stress on your knee, and help improve your knee pain. The first exercise we're going to start with today is a glute bridge to target those muscles on the back of the hip. Powerful muscles that we're going to start with today, and target those muscles to better control your upper leg and your knee to help with your knee pain. For this glute exercise, you're going to start on the table or floor, lying on your back. With your feet shoulder width apart, you're going to squeeze your bottom, lift up off the table or floor. Squeeze your bottom, lift up off the table or floor, hold 5 seconds, and then slowly come back down. Squeeze your bottom, lift up, hold 5 seconds, slowly come back down. Start with 10 reps with this one, 2 to 3 sets. And then we can progress to a single leg bridge to further enhance that strength and stability in your hip to better control that knee. So for the single leg bridge, you're going to have one leg bent, the other leg is going to be resting down. You're still going to squeeze your bottom, but now you're going to push up with one side of the hip. So same idea, squeeze your bottom on that one side with the one leg bent. You're going to push up towards the ceiling, hold 5 seconds, and then come back down. We can perform 10 reps on one side and then alternate and perform 10 reps on the other side, working up 2 to 3 sets on both sides. For our second hip exercise today, we're going to perform clamshells. These are going to target the outside and back of the hip, smaller, stabilizing muscles that really help better control the upper leg and the knee to help you with your pain. So for the clamshell exercise, we're going to perform this lying on our side. So lying on the table or floor, the top hip, the hip we're going to strengthen is going to be the one on the top facing the ceiling. In the sideline position, lying on your side, you're going to have your knees bent up to about 90 degrees. You're going to keep your feet together. Hip is going to be rolled forward slightly, that top hip. You're going to lift your knee up towards the ceiling. Lift up towards the ceiling, slow and controlled. Pausing at the top, and then come back down. Start with 10 reps, 2 to 3 sets, and then we can progress this one as it gets easier, adding a band, a resistance band around the knees. So same idea, having the band around your knees, right above the knees. Open up, pause at the top, and then control back down. Lift that knee up towards the ceiling, opening up, and then come back down. Same with this one. Start with 10 reps, 2 to 3 sets, feeling that fatigue, that muscle fatigue on the outside back of the hip. Our third hip exercise today, we're going to perform hip abduction lying on our side. This exercise is going to target the gluteus medius on the side of our hip, a stabilizing muscle, strong stabilizing muscle that's going to improve your hip stability to better control your upper leg and your knee. For the hip abduction exercise, we're going to be lying on your side again. The top leg, the top hip, facing up towards the ceiling is going to be the one we're going to strengthen today. Keeping your leg straight, you're going to lift that top leg up towards the ceiling. So lift that top leg up towards the ceiling, slow and controlled, keeping that hip forward. Lift up to about 30 to 40 degrees, and then come back down. Keeping that leg straight, slow and controlled up and down. Perform 10 reps, slow and controlled, and then 2 to 3 sets. Feel that muscle burn and fatigue right on the outside of the hip to know that you're targeting that muscle to improve that strength to better control your knee. We can then progress this exercise to add a resistance band to further progress that strength in the hip. Adding that resistance band right above the ankles, so loop that band right above the ankles Same position with that hip forward, keeping that knee straight. You're going to lift up towards the ceiling, slow and controlled up, and then come down. Same position, keeping that hip forward, lifting up against that resistance, feeling that fatigue on the outside of the hip. Perform 10 reps, up to 2 to 3 sets, improving that strength in the hip to better control your upper leg and your knee, to decrease stress in your knee, to help improve your knee pain. Thanks for watching today, guys. Perform these 3 hip exercises to help improve your knee pain. If you found today's video helpful, click that like button and the subscribe button so you don't miss out on future videos. I'm Dr. Josa, helping you to move better and feel better.